Hello everyone, you're watching PhysioClassroom channel, and in this video I'm going to share with you all yet another very important soft tissue treatment technique that can be utilized by the physiotherapist to treat patients of upper cross syndrome. This technique focuses on removing strain from the myofascial tissues and joints of the upper thoracic spine that often arises from long sitting hours in abnormal posture. So utilize this treatment technique along with the strengthening of the middle and lower fibers of trapezius muscle to get excellent results in patients who have rounded shoulders and hyperkyphotic upper thoracic spine. So let's get started with the practical demonstration of the seated over and under technique. So to deliver the over and under technique, the therapist makes the patient assume the short sitting position. And now the therapist asks the patient to cross the arms in such a manner so that the first web space hooks around the contralateral arm in this manner. Now once the therapist makes the patient assume this position, the therapist next stands in the step standing position and then reaches under the arm of the patient and then over the shoulders. The therapist next places the finger pads of both the hands besides the spinous process so that it is covering the soft tissues overlying the transverse process region. Now by shifting the body weight from the front to the back leg and using the forearm of the patient as lever, the therapist creates minimal extension in the thoracic spine, and at the same time the finger pads are engaged or engaging the soft tissues in the anterior and superior direction. This position is held for 4 to 5 seconds before returning the patient back to the neutral position. Gradually the therapist can keep on changing the position of the finger pads, moving from inferior to superior direction, and again repeating the technique of engaging the soft tissues in the anterior and superior direction. So this was all about the practical demonstration of the over and under technique. Do try and utilize this in treating your patients who complain of pain and stiffness in the upper thoracic region. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.